I had the pleasure to present the LATITUDE data, or actually Kim Shi, my colleague, presented them. That's teamwork. And that's the final data of the LATITUDE Phase III program that we conducted in men with de novo metastatic prostate cancer. These patients were selected as having a very high risk of death. They had to have 2 high risk out of 3 criteria. And the randomization was between androgen deprivation therapy plus or minus Abiraterone and Prednisone. 2 years ago, we reported the first interim analysis supporting improved overall survival and also improved radiographic progression-free survival, favoring the Abiraterone arm. Now, with almost 2 years of additional follow-up and much more men from the control arm receiving a salvage treatment, either Abiraterone, enzalutamide, or Taxol, or some other drugs, we see that the benefit remains. The hazard ratio is essentially the same, with a 34% reduction in the risk of death when Abiraterone is being used early in the course of the disease in these high-risk men. So that converts in about an 18-month absolute difference in median overall survival, which is just big, and it comes together again with better progression-free survival, but also time to pain deterioration, which is very clinically meaningful, about a 30% reduction in the risk, and of course many other secondary efficacy endpoints. Regarding safety, where basically we haven't seen any long-term side effects in these men as compared to what we originally reported. So we're talking about excess in hypertension, hypokalemia, and rarely increased transaminase, but basically no more than that. So we're very happy because I think we've set a new standard of care for these men, and hopefully this will benefit to many men on Earth.